Hiya everyone. Welcome to this webinar providing an update on the commissioning work currently being undertaken by the Department of Communities. For those of you who don't know me, my name is Karen Irwin. I'm the Assistant Director General of Strategy and Partnerships. And myself and Michael Cravola, the Chief Financial Officer, are the co-sponsors of this very important project. Before we begin, I would like to respectfully acknowledge the Whadjuk Noongar people, the traditional custodians of the land that we are meeting on. And I'm so sorry. I would also like to acknowledge traditional custodians throughout Western Australia, recognising their continued connection to the lands, families and communities. And I would like to pay my respects to elders past, present and emerging. Today, we will be sharing with you an overview of the work completed to date, an indication of next steps for 2022 in each of the 4 priority areas. We will also be launching Communities Agency Commissioning Plan and outlining the priorities for that work throughout 2022. Another important piece of work that will complement and inform the commissioning work into the future is the ACO strategy, which Cheryl Smith, the Assistant Director General from Aboriginal Outcomes, will also provide an update on today. There will then be lots of opportunity for you all to ask questions. Similar to the last time that we came together, we encourage you to ask questions at any time during the webinar using the chat box. We will get to all of these during the Q&A session. The questions will only be moderated to ensure we don't double up and to join together questions that are very similar in nature. And any questions that we don't get through today, we will answer and publish the answers on the website. I'd encourage you to like any of the questions so that we know which ones have the largest priority or are most relevant for the most people. I would now like to welcome and introduce our Director General, Mike Rowe, to open the webinar.
Thank you very much, Karen, and good morning, everybody. Thank you so much for joining us today. It's a really important update that we're providing you today on really important work that we're doing at the Department of Communities. I also would like to acknowledge that we're meeting today on beautiful Whadjuk Noongar Budja, and I pay my deep respects to elders past and present. Look, I'm really pleased with the work that's happened over the course of the last few months, and it provides the opportunity to talk to you today about this very important program that we've done. Commissioning cannot be achieved without a true partnership, and your involvement and engagement over the last 10 or so weeks has been really integral to this process. I stated at our 23rd of September webinar that I'm really committed to delivering better outcomes for children, young people, their families and communities. This commissioning project has provided us opportunities to work closely together with service providers and other key stakeholders, working towards a shared outcome of delivery of better services for our community. The commissioning team has worked incredibly hard. They've delivered 14 design labs with a total of 632 attendees to support the commissioning of services across the 4 priority areas. The dedicated webpage has also allowed us to share information and provide regular progress updates transparently to all stakeholders. Next year, we'll begin the procurement process for contracts ending in 2022, as well as continuing our work for future commissioning cycles. And I take this opportunity to acknowledge the very significant time commitment from all of you, and I thank you most sincerely again for your ongoing engagement and participation in shaping our commissioning approach. The goodwill and intention surrounding this project is very energising, to say the least. I previously highlighted my desire to see how we as a state government can work better together. And I'm really pleased to see the beginning of that work and the establishment of a cross-agency commissioning working group that includes all government agencies commissioning human services in Western Australia. We've heard your feedback that government agencies need to work more closely together to align processes and identify opportunities for collaboration and future co-commissioning of services. This working group will provide an important mechanism to begin to drive that work, and I look forward to sharing outcomes with you all in the future. We've also invited the Mental Health Commission and the Department of Justice to participate in a workshop in January next year to identify opportunities to work together in commissioning homelessness services in the future. Another important pillar to the progress of the commissioning work is the establishment of 2 important working groups through the Community Partnerships Roundtable. The commissioning working group is co-chaired by John Buffler from Community Employers WA and Elaine Patterson, our Community's Executive Director of Contracting, and will further strengthen the partnership work in the commissioning space. I understand that the terms of reference will be published on the commissioning webpage in the near future and regular updates provided to stakeholders on the progress of this group. The second working group will focus on data and outcomes and is co-chaired by Chris Toymey from WACOS and Paul Isaacson, Assistant Director General from Governance, Integrity and Reform here at Communities. Members of the working group are drawn from peak organisations, and the focus will be on how communities and the sector can work together to connect data to outcomes and to share this data for improved service design and delivery. In another demonstration of our commitment to working in true partnership, I'm advised that representatives of our 2 family and domestic violence peaks are currently working 1 day a week with Communities Family and Domestic Violence Unit at our head office here in Walyalla. This will further support the commissioning of family and domestic violence services progressing in partnership with the sector. It's clear that there's been a tremendous amount of work and of progress since our last meeting at the end of September. Much of this foundational work will support further success in 2022 and beyond. We've commenced a very ambitious program of work, which has required an enormous amount of commitment and flexibility in our approach. We won't get everything right in this process, but we rely on your feedback to ensure we can continue to improve our approach moving forward. And I thank you all again for your ongoing engagement in this exercise. Thank you very much.
Thank you, Mike. I'd also like to share my sincere appreciation to you all for your engagement and your involvement in the commissioning and in the design lab work. There's no doubt that what we are doing is ambitious, and our success so far is absolutely reliant upon the work of yourselves and the teams in Communities. I'm now going to provide a brief progress update on each of the 4 commissioning areas prior to handing over to Michael and Elaine to talk about the commissioning plan, Cheryl to talk about the ACO strategy, and then open it up to questions. I'll begin with the Child Sexual Abuse Therapeutic Services and Indigenous Healing Services. The commissioning of these services has a slightly longer timeframe, which has allowed communities to focus on working with service providers to identify issues and opportunities that will inform future service design. A key action from Design Lab 1 was the establishment of sector support meetings facilitated by communities but driven by service providers. To date, there's a commitment to undertake 3 meetings covering the topics of workforce capability, expansion of mandatory reporter groups, and a briefing from the National Office for Child Safety on the implementation of the National Strategy to Prevent and Treat Child Sexual Abuse. Further meetings will be convened as requested by that group. The priorities for 2022 will be a focus on client journey mapping and profiling need and unmet demand for these important services in our community. Through this work, we will be well placed to recommend service models for responding to child sexual abuse into the future, and service models that put children and families at the centre and provide wraparound support, advocacy and therapeutic services. In the Family and Domestic Violence Services area, the work over the last few months with family and domestic violence service providers has included 2 design labs with approximately 140 attendees across the 2 sessions. The second session was a face-to-face meeting following very strong feedback from attendees that online sessions was not conducive to the sort of collaborative activities we were asking people to participate in. I am informed the opportunity for services to meet for the whole day to discuss the critical work of family and domestic violence service provision and the strategic direction for the next 5 years was both dynamic and positive. Your input from these design labs will inform the development of a 5-year transition plan for these services. The 5-year plan builds on what we've already heard through co-design processes relating to the hub and the procurement of the 2 new women's refuges, and our engagement with services throughout the development of Path to Safety, the strategy and the National Partnership Agreement. I'm advised that Communities is currently consulting with the peak services about the first draft of the 5-year transition plan and will be in a position to release it to the broader stakeholder group for feedback, discussion, engagement and ongoing iteration in early 2022. The transition plan is intended to be a joint commitment between communities and service providers to work together to ensure the sector as a whole is prepared. Initial priority areas will include increasing the Aboriginal ACO service delivery, the development of outcomes, data collection and evaluation, development of quality standards, workforce development, innovative and flexible service delivery, and improvements to communities' contract management processes. Actions under each priority area will assist us to build the evidence base to demonstrate need and inform potential future investment. For those services with contracts expiring the 30th of June 2022, communities will be intending to contact service providers in early 2022 to progress the contract extensions. Out-of-home care services is the next area. 4 design labs have been held in the commissioning of out-of-home care services, including an ACO-specific design lab. The design labs have centred around the procurement of 4 service types, initially developed by the Independent Reference Group as part of the out-of-home care reform. These 4 service types are short-term care, community foster care, group care and complex care. In 2022, communities will continue to work closely with key stakeholders on issues such as bringing decision-making closer to the child and progressing draft tender documents for feedback. To support increased ACO service delivery for children and young people in out-of-home care, communities will be releasing an EOI in the next week for interested ACOs to register their interest in delivering these services. Communities will work to develop an appropriate procurement approach in early 2022. This includes the release of draft specifications for feedback from key stakeholders prior to releasing formally. We have heard the strong feedback from the out-of-home care sector about what Reform Communities is undertaking to support this commissioning work. Given that Communities delivers 80% of out-of-home care placements, we know it's imperative that we also improve our systems alongside the commissioning work. Key reforms will include the implementation of the legislative changes from the Children and Community Services Amendment Bill, including changes to the Aboriginal and Torres Strait Islander child placement principle to prioritise placements in closer proximity to the child's community if placement with family or an Aboriginal person in the child's community cannot be achieved. Stronger consultation requirements when arranging who a child in care should live with. These will be referred to as placement arrangement, as well as consulting members of the child's family and relevant Aboriginal staff in communities, in the Department of Communities. Consultation will also have to occur with an Aboriginal or Torres Strait Islander representative organisation. These changes are intended to achieve placements that are higher in the placement hierarchy of the child placement principle. Communities will also establish a Director of Fostering Services who will work closely with departmental and non-departmental fostering services to improve processes and support better outcomes for children living in out-of-home care. As most of you know, child protection reform is continuous, and we will continue to work closely with the sector, families and children and young people in 2022 to further strengthen our care system and ensure it is flexible and responsive to the changing needs of our community. The final of the 4 areas is homelessness services. As mentioned by Chad in the previous webinar, Communities is taking a slightly different approach to the procurement of homelessness services. A 2-year homelessness service system trial in the southwest, which will then inform the commissioning of these services across the state. A short video has been prepared that captures some of the action of Design Lab 1, which I am pleased, the technological gods willing, to share with you today. All right, for those of you who can't lip read, we will be publishing the video online as soon as this webinar is finished. And my apologies, with the best set of intentions, it works very well during rehearsals, but I don't think we did justice to either Chad, Amber or the others who were involved in that presentation. So what we'll do is we'll publish that as soon as the webinar's finished with sound, so you'll all be able to have a look and hear about the wonderful work that's been going on in the Southwest. Draft negotiation documents have been released to Southwest service providers for their feedback by the end of 2021. The remainder of homelessness service providers with contracts ending in June 2022 are intended to receive a 2-year contract extension. 2022 will see communities engaging with service providers across the state to begin the commissioning cycle. I would now like to invite Michael Cavola, and who is my co-sponsor on this important project, and Elaine Patterson, to launch Communities Agency Commissioning Plan.
Hi, and unfortunately there's no drum roll for me to announce the Communities Commissioning Plan too, but it is being launched and Elaine will be taking you through in just a few minutes. Basically, the Communities Commissioning Plan represents a commitment to improving the way we commission services, more importantly, including engagement and co-design with the sector. The commissioning approach is cyclical, with the flexibility for continuous improvement to maintain contemporary service delivery to better meet the needs of the state's most vulnerable people. This plan focuses on the contracts expiring in 2022, including the 4 priority areas that Karen's already spoken about. I'll now hand over to Elaine to provide you with more details about the plan, how we're going to implement that over the next couple of years.
Good morning, everyone. I am going to say I'm hugely pleased to announce that we can publish the agency commissioning plan today, and I also want to add my thanks to all the hard work and efforts that people have been making, particularly over the last 6 months, to get it to the point it's at. As many of you know, that the state government is working on the state commissioning strategy, and our agency commissioning plan will feed into that strategy. Department of Finance are working on an implementation plan just now, and we will continue to work closely with them. But we thought it was really important to be really transparent and put up and make it clear the work that we've been doing on our agency commissioning plan, and talk a little bit about what we need to do for the next year, because we all know this is going to be a big year next year. There's so many contracts all expiring at the same time, but also give an indication of where we want to go in the future. So just to reiterate, and I know I've said this at some of the design labs already, so sorry, bear with me if you've heard this already. But it really is, it was so important to have that collaborative partnership as we were working through how we deliver better and more innovative services. The Department of Communities in the past has been a bit criticised for many contracts that have rolled over for lots of years. So what we want to look at is how can we improve the services, because it really is about getting the best possible services we can to individuals who are really vulnerable. So doing that kind of consistent commissioning approach and making sure it's grounded in those kind of outcomes and the outcomes that we want to see for individuals and what they want to see for themselves is going to be really crucial as we move forward. And we've talked already about how we're looking at the Southwest for homelessness pilot. That's one of the key things we want to look at in terms of commissioning, how we can do more place-based services, and we'll be working through that in the future. We've also mentioned that it's going to be really, really important about how we prioritise the leadership of Aboriginal people, and we've got closing the gap targets and things to meet, and we need to be working through how we do that. So I'm looking forward to hearing Cheryl talk about the ACO strategy and how we can make sure the commissioning work ties in with that. And at a state level, there's been a real focus about how we as a government look more about the kind of early intervention and prevention side. I think as a government generally, we're pretty good at the kind of crisis end, and that's a kind of bit of a focus, and it has been. But how do we change that and start to try and do intervene a little bit earlier so that we stop people getting into that kind of crisis point? And we also want to look about how we're going to strengthen our monitoring, evaluation and review of services. And every time I've said that, I can collectively feel the roll of eyes, which people think there's going to be a huge bureaucratic burden on them. That's not the point at all. It's about what kind of information do we have, what kind of data do we have, how can we streamline what we do, how can we use it better, the information we have, so that the services that we have are more grounded in evidence. So again, not looking at creating a massive bureaucracy, but just working with you to think about what services and what information do we need to provide the best services we can. So we've talked a lot as well this morning, and I know lots of the design labs about the priority areas, but there's a significant number of contracts also ending next year that are not in the priority areas. And I know people have been asking me what happens to them. So in kind of broad, roughly portfolio areas, there's things like financial counselling, youth services, senior services, carers, parenting services, and there's quite a few other community development services. Now that's kind of a bit of a broad brush, but there's probably, the number kind of changes depending exactly how you count each individual contract, but potentially over 200 of those. Given the amount of work that's happening in the 4 priority areas, taking a pure commissioning approach to them would be really difficult in terms of the amount of work that you guys at the sector would have to input, given the amount of work that you're doing on the priority areas. So we'll be working through each of them, and we'll be talking to the service providers, but the intention is to work with you and maybe look to see whether we can extend them for either a shorter or longer period, and then we'll work through a proper commissioning approach in the years to come. So launching the commissioning plan today, I'm being a bit sad because I'm quite excited, but the idea is we'll put it on the website today, people will be able to access it, there will be a part on the website you'll be able to put comments in, and we recognise that this plan, and we've mentioned before that this is not just a set and forget, there's a plan, we leave it. This is going to be quite a long-term process of how we improve, how we commission services. So this is our first agency commissioning plan. We'll be updating it as we move through next year particularly, and we go over, I don't know if it's a hump or a cliff of all the contracts that are ending, and then we'll learn some feedback, we'll feed that into the plan, and we'll have a new plan, I would imagine probably towards the middle or late next year. But we want to see if we can do that probably on an annual basis. Again, we'll be working with the Department of Finance because that may happen with the state commissioning strategy. I'm not sure yet, they're working through some of that work now. But from our perspective, we want to be as transparent and open as possible, so we will be looking to issue a plan every year. And as we do that, it's going to be absolutely critical to continue to work in partnership together and continue that focus on getting the best possible outcomes we can for individuals that need the service. So it will be an ongoing process, and that just if you can bear with us, because we won't get everything right away, and you'll see the plan today, and I'm sure there may be some feedback and things on the plan where things aren't perfect. But I think it's the start of the process. So yes, we will welcome any feedback, and we will keep improving it as we go forward. So lots to do, lots of work's happened, but lots to do in the future as well. But what we want to do in the meantime while the work is ongoing, just to let you know some of the stuff that's happening internally in communities to just improve how we do some contract management and support our approach to commissioning. So we want to move to a way we have head or master agreements. And by that way, I mean, like if as an organisation, you provide 5 family domestic violence services to us that are all fairly similar. Rather than having 5 contracts, we'll have 1 contract with a schedule behind that. That will take us a few years to work through that approach. It won't happen overnight, but that's definitely our intention. And we might start with groups of services together. So, for example, the FDV services or the homelessness services, but we're working through that in the next few years. We're also going to be taking a much more active relationship-based to contract management. I think there has been at times a slight tendency to get a bit transactional. But the idea is we need to have relationships to work together in partnership to try and improve services. So that's what we need to move to. So we'll be looking to see how we can, which contract managers look after and which relationship managers. So we will be looking at how that all works in practice and trying to streamline things. So as a service provider, you don't have 5 contract managers, you'll have 1 main relationship manager. We want to look at how we can reduce the admin burden where possible, and one of the things we're actually working on right now is about service reviews, because they seem to have become, from my perspective, fairly bureaucratic and quite time resource intensive. So we're looking to see how we can improve them and streamline them to make it much easier for you and much easier for us, because again, that's something I think that's happened over time and it's just continued to. So we're kind of trying to question some of that and trying to streamline and improve how we do things. We want to move to more outcomes-based agreements and look at how we can reduce the reporting requirements. Again, if you have a master or head agreement, you might not need to report 5 individual times because you don't have 5 contracts, you only have 1. So those kind of things we want to kind of look at and work with you to try and improve. And we also want to look at how we encourage innovation throughout the term of the contract. So for example, it's not just there's the contract, we'll see you again in 5 years' time. It's if we can include with your agreement an innovation clause in the contract, we can work together and figure out how we can improve things over time. I did have someone from the community services sector did tell me that that's going to be fantastic for them, but government are going to struggle with that. So can you bear with us on that one as well? We do want to move to that approach, and we're going to try our best to, but again, we might not always get it correct, but we are going to absolutely, we're committed to trying. So I say lots and lots of work has been happening, and I thank you again for all your input and support. It's been really fantastic, but we also recognise there's lots of work still to be done. So I'll just hand back to Michael, who'll talk about priorities in 2022.
Great, thanks for that, Elaine. As you can see, there's going to be implementation. The commissioning plan is going to be an ongoing piece of work. It's all about continuous improvement and making it work better as we go through the various iterations of that. So I reiterate Elaine's sort of comment that we are going to be working with you guys over this for a number of years, and hopefully we'll get this better as we keep going along. So since September 2021, we've commenced on a program of broad stakeholder engagement across the 4 priority areas. But in 2022, we'll be further refining this work by prioritising engagement with the ACOs to support increased ACO-led service delivery and inform future commissioning cycles. We're going to be looking for opportunities for further cross-agency collaboration between the whole of government, as well as harness the synergies we've identified across the 4 priority areas. So all of this work is intended to put us in good stead towards planning for the future commissioning cycles.
Thank you, Michael and Elaine. Michael and Elaine will stay to be part of the question session afterwards, but now I'd like to introduce you to Cheryl Smith. Cheryl is the Assistant Director General in Aboriginal Outcomes Division, and Cheryl's here to provide us with an update on the development of Community's ACO strategy, which, as you can hear throughout this presentation, will be a key driver of the commissioning program of work in 2022.
Thank you, Karen. And as you have heard from both Michael and Elaine and Karen also, is that the ACO strategy itself will be one of our larger commitments going forward in 2022. So the ACO, which is the Aboriginal Community Controlled Organisation Strategy, is a strategy that commenced in communities in 2019. So I've been fortunate enough to come in the end part of the strategy itself. So I get to see all of the fun things that we're going to do in rolling out this strategy. But there are some people that have done a lot of work behind the scenes in this, and those people actually need to be acknowledged as a part of being able to step forward and really talk about what the commitment is that communities will make in changing some of the way that we provide services with Aboriginal people. So some of those people are the Aboriginal Outcomes Division team. We do actually have an ACO team, but another person that's been instrumental in leading this part of work across communities has been Jacqueline Littlejohn. So I do want to actually acknowledge those people. And this has been a piece of work that has been driven by a community group themselves. So we had a number of ACOs that would come in and actually provide their advice and a way forward on this. So there was a project working group, and that comprised of 11 ACOs. And so they were from around the state, and some of them were ACOs that had focused in a health service, and some of them were actually around social wellbeing. And when you think about that, there are over 700 ACOs that are actually registered in Western Australia alone. The possibility and the options for communities to be able to work with ACOs is really actually quite exciting. So there has been this whole lot of work that has happened, but the ACO strategy itself actually fits within the state government's national agreement. It also fits within the Aboriginal Empowerment Strategy, which is the WA state strategy, but it also is a part of the strategic plan of communities, and it is a deliverable for communities' annual plan in the 21-22 period. So it is a piece of work that actually is underpinned by our commitment. And when we think about the vulnerability of the Aboriginal community that we work with, being able to actually have this strategy rolled out across communities really demonstrates our commitment. So the strategy itself sits under some strategic objectives. And so this is about how we provide support for ACOs to be able to deliver in this space. So we have to have organisational growth and improve decision-making abilities of communities to maximise an ACO involvement in delivering services to Aboriginal children, families and communities. We also have to have the governance structures to improve, to prioritise economic and social economic opportunities for ACOs. We have to have service delivery models that are co-designed with ACOs, and you've heard the panel speak about our partnerships, but not only our partnerships, our continuous improvement, and that is a continuous improvement of our partnerships. So these have to be locally informed, they have to be place-based, and they have to be culturally appropriate services for Aboriginal children, families and communities. We are not saying that ACOs need to have our support in being culturally responsive. What the strategy says is that we provide support in ACOs for them to actually be the most suitable service providers place-based to deliver for Aboriginal families. And our frontline service delivery to Aboriginal children, families and communities will be transitioned to local place-based ACOs. And we have to do that because that is actually a part of our commitment. So the ACO strategy itself is about how we provide services for Aboriginal people place-based, but it's also about how we build our stronger partnerships. One of the commitments in the ACO strategy is not only do we build those partnerships in our communities, but how do we actually maintain those partnerships going forward? So there really is a lot of work to be done in this space. It is not going to be an easy process. This is a new way for us to do business, and the ACO community and the Aboriginal community are really looking forward to how communities step into this space to be able to enable them to actually provide those services in their families. So there is a vision for the ACO strategy, and that is Aboriginal children, families and communities are empowered to choose their own futures from a secure and sustained foundations provided by ACOs. And this is about how we lead into self-determination. So self-determination, a statement by itself, needs to actually have actions that sit behind that. And I think the communities and the CLT and the people that are out there doing the work in our community space are actually about self-determination for Aboriginal communities. So the purpose of the ACO strategy is it will provide a framework for how communities will work together with and support West Australian ACOs to achieve self-determination to create safe and healthy families and communities. And underpinning this, there are 3 pillars, and those pillars are, and this is a no-brainer for people that are working in the Aboriginal space, it has to have cultural safety and governance. And so the cultural safety will be led by the ACOs. Communities, us as in communities, will actually then provide the governance that sits around that. We have to be able to build partnerships. I speak about this all the time. When you are stepping into the Aboriginal space to work with Aboriginal communities, it is about partnerships. And I say partnerships, partnerships and building relationships. So we have to build genuine partnerships and engagement with ACOs. It's no more us telling ACOs what they need to be doing. It is about sitting down and having those honest conversations about how do we actually do this so that we get better improvements and outcomes for Aboriginal families, children and communities. So they are 2 of the areas, but the third area of this is about the economic opportunities. How do we develop self-determination, build healthy communities while we're actually providing the opportunity for that real economic development and opportunities in communities? So we have to give ACOs economic and socio-economic opportunities to deliver in their own communities. Our challenge for us is, when we think about this in a metropolitan context, it may be a bit easier than when we start thinking about this in a remote or regional context. So if we're looking at providing ACO strategy support in regions where there are not a lot of ACOs, then how do we as communities ensure that we are building the capacity of the communities so that they may actually develop into ACOs? So this is a really new way for us to do business. It is an exciting way. It is a committed way that we will actually work with Aboriginal families going forward. So that's the current situation, but what we need to do now is we need to actually plan what this is going to look like. And Michael spoke about this. What is 2022 going to look like in that ACO space? So for Aboriginal Outcomes Division in communities, we have a role and responsibility to ensure that we are supporting all of communities' divisions around how we do this. So what we don't want to do is we don't want to actually go out there, make such a big mess of it that the Aboriginal community start to back off and go, well, you don't really know what you're doing. What we want to do is actually stage this. So this is a staged approach. The current ACO strategy and the release of that will be stage 1. Stage 2 will actually be looking at how do we now start to, we've planned this, we're going to now roll it out, we need to review it and we need to evaluate it. And in all of that process, it actually needs to be monitored, because what we need to do is we need to demonstrate that this is actually making a difference. So I'm looking forward to working with not only the divisions, but certainly contracts around how we can actually make this strategy a strategy that we can stand there and go, this is just fantastic, they are meeting outcomes, and one that will actually put communities in a great position to be able to truly talk about how we're making changes in that Aboriginal space. And I think, is that my 5 minutes? I can talk about this for a very long time. But if that's
the good news
minutes,
is, Cheryl, thank you very much. The good news is that it's now time for our question and answer session. Mike Rowe is still in the room, as is Michael and Elaine. I'd also like to welcome Stacey Collins from the Office of the Prevention of Family and Domestic Violence, Mark Burgess from the Specialist Child Protection Unit, Chad Stewart, who's heading up the Homelessness Procurement, and Nicole Leggett, who heads up the Royal Commission team. What we're going to do now is we're going to ask Nikki and Tam to read out the questions. Can I reassure you that any questions we don't get to in this session, we will answer later and we will publish them on the website, along with that video and our commissioning plan. Over to you.
Cool. I think the first question might be appropriate for the DG to answer. It seems a lot of this work is planned over a number of years to come. What assurances do we have that communities will continue to see this as a priority, particularly as leadership continues to change?
Okay, well, to the extent that I'm Director General, and my current plan is that I'm here for at least 5 years, that this will be a very important priority for us as an agency. So you've got my personal commitment that it will continue to be a priority for our organisation. Our leadership at CLT is fairly stable at the moment. There's a couple of vacancies which we'll be looking to fill in the next year, but that won't change either. And probably more importantly than that, you've also got the strong commitment from our Minister, our main lead Minister being Minister Simone McGurk for each of these 4 areas. And underpinning it all, it's an election commitment of the current government that we move to longer term contracts. So I don't believe that it will be shifting for us as a priority anytime soon. It will remain a very strong priority for our organisation going forward.
For Elaine, can you please clarify the period of extensions for family and domestic violence service providers beyond 30 June 2022?
We're working at the moment, our intention would be to move to a 5-year extension. That's obviously subject to some funding discussions that we still have to have with government, but that's certainly our intention, is to move to the longer term contracts.
Perhaps Mac or Elaine, will there be any form of uplift to the value of contracts that might be extended outside of the priorities?
So that will be a discussion that we have as part of the current state budget process that will be announced or working through currently. So in terms of additional, any sort of funding requests that are going through government at the moment, they'll all be dealt with as part of the state budget process.
And linked to that question, is there a chance that some contracts expiring next year, which do not fall under the 4 categories, the priority areas, may not be extended?
So the intention is we'll be extending all of those contracts out for a period of time to allow us to move them to more of the commissioning cycle as well. So again, the ones that we don't deal with by the 30th of June 2022, there'll be an extension put forward, so we'll start to deal with them through a commissioning process in 2023.
Mark, how will invitees list for the EOI to ACOs interested in out-of-home care be determined?
So our intention is to go to all ACOs across the state so that no one is left out, so that it is a transparent process and goes out to everyone all across the state. And obviously we'll be enlisting the help of Cheryl and her team, who have a very robust contact schedule for ACOs across the state. So that's our intention.
I'm not sure who wants to answer this question, but the principles of the agency commissioning plan state that focus will shift towards early intervention and prevention. Will this be reflected in the treatment of existing contracts that do not sit specifically in any one of the 4 priority areas, but support each of them?
I think that's probably a general intention for all government services, that how we move to that more early intervention and prevention. That doesn't mean to say that we completely change the services that we purchase now. So I think that's a piece of work going forward across all government agencies, not just specifically to communities.
Maybe if I could just add too, like there are multiple ways to communicate and to get answers to questions. So if you're a specific service provider and you have a specific question about your commissioning, don't feel you have to only communicate with us through a webinar or a process like this. I think that we have made available all of the project leads, including Elaine's, email addresses and phone numbers, so you can call them and just talk through any specific concerns that you might have.
Chad, for you, a transition plan was mentioned for the family and domestic violence commissioning strategy. Are you thinking of a transition plan for homelessness commissioning too?
Absolutely, and I think that'll be the focus of 2022. We've got 4 workshops planned for the broader state, and obviously we'll be leveraging the real-time learnings from the Southwest trial, but that will be the plan to have that transition approach in place.
Nicole, in relation to CSATs, will there be opportunities for new services to be funded in the early intervention prevention space?
It's a really good question. I think really that's the whole point of doing the commissioning plan. So we've got a lot of work to do around understanding what are the service models that we want and what is the need and unmet demand in communities that then will inform the case around improving the financial sustainability of the services that we've got and potentially growing that sector into a range of new types of service models. So I don't have a direct answer to that question, but certainly the intention is that we will be canvassing all of those types of things in the commissioning plan.
Elaine, another question for you. When will agencies be advised of their extensions? I'm assuming this is for contracts ending 30 June next year.
We're hoping it will be just early January, so we'll start conversations with people early January to let people know what's happening with extensions. As I said, we won't have any certainty of funding for a little while, but we'll definitely start conversations and kind of agree the length of extension and then start talking about the funding once we have some certainty on that ourselves.
And another general question, how are outputs going to be determined and measured?
Outputs or outcomes?
I think it means outcomes. They have written outputs though. Yeah, outcomes.
Well, there is another working group as part of the Communities Partnership Roundtable, and that's one of the things they're looking at is data outcomes, how things can be measured. There's another piece of work that's also happening across Department of Finance. There's been some pilots and looking at how we can do that. So again, don't have a definitive answer. It's definitely going to be a work in progress. From my perspective, the main thing is that we don't create something that's hugely bureaucratic, but then does that service make a difference to someone on the ground? Has it helped someone or hasn't it? That's the key thing that we need to kind of find out.
And this is in relation to the 5-year intended contract extensions for family and domestic violence. The commissioning principles include innovation, yet extensions are for 5 years. Is that correct?
Yes, but the new extensions will have the innovation clause in it as long as service providers accept that, and that means that we'll be able to work through the 5-year plan and start to implement innovation and changes to services as we go. So by the end of the 5 years, the service might look quite different from how it does now.
And we often see differences in our contracts and the delivering community services and partnership policy. Is this something that will be addressed in the strategy and plan so it's more aligned between the Department of Finance and contract managers?
Well, we continue to work with the Department of Finance about, as I say, the state commissioning strategy and the DCSP policy. At one point there was some discussion about whether that was going to be updated. I'm not sure if it is now, but we will continue to work with finance on that. And if there's any specific examples, I'd be really happy if someone can send me some information on that and we can try and get to the bottom of it.
Has the department done any research on best practice commissioning and procurement that can be shared with the sector?
I know the Department of Finance have. They have a team that's been looking at that as part of the development of the state commissioning strategy. So I'm happy to take that up with finance and then we can share what information we have. Because I knew New South Wales particularly had done some work and they had a sort of like a 10-year plan, but they had like annual, or I think it was every 2 years, that kind of implementation plans about how things would be achieved. So there's definitely some work out there we can share.
How will the department support agencies or services that have been locked out of the opportunity for funding due to continual rollover of contracts and no open tenders?
Well, that's what we need to think how we do that commissioning moving forward. So that's one of the ideas about how we continue to do innovation for existing contracts, but probably where we may be going more towards tender is the out-of-home care services. So there will be some, and any new services that come out will go to the open market. So there will be new services that will be getting tendered to openly as usual, but as part of our ongoing commissioning approach of how we're going to do that going forward, because we need to balance as well how much the sector can deal with new open things, because we could not possibly have done all the 4 priority areas going out to open tender at the same time. The sector could not have coped with that, we could not have coped with that. So there's a bit about like how do we plan that, and what we want to do is a pipeline of work over the next 5 years, and keep that rolling and updating it every year so that people know when contracts are ending, and then we'll put in the plan what our commissioning intentions are. So that's a kind of watch this space as we go forward.
Another question perhaps for Mac. Outcome commissioning and early intervention relies on building capacity across both sectors. Is there a plan and resources to do this?
So again, this will be part of the transitioning plan as we move through our commissioning cycle as to how we're going to enable people to interact with us and what development people are going to need to move to this new way of working.
If contracts are moving towards an increased emphasis on outcomes, will future service agreements continue to include output-based KPIs?
Well, we still have to meet as a department, we have KPIs that we have to meet as part of our outcomes-based management framework for government. So there's some government-based KPIs we have to meet. There's also some reporting and things we have to do at a national level. So those will still have to continue, but that's why we need to find a balance between how we'll move to outcomes and continue to do some outputs, but how do we do that in a practical way that does not increase the admin burden? And that will be tricky. I don't think there's an easy answer to that, but we're just going to have to work through that over the next few years.
Another question, where do the peak body contracts fit into this new commissioning world?
I'm not quite sure I understand the question.
I guess if they wouldn't be included in any of the 4 priority areas, the contracts that we have.
No. But they would be included in my understanding is that I don't think there's any that are up for expiring next year, but they would be tied into the commissioning approach along with every other contract.
Given the scope of the work and the need for ongoing communication with the sector to implement the commissioning program, will additional resources be provided to the department and the sector? I'm not sure who wants to answer that question.
So I think, again, it'll be something which we plan out how we're going to implement these things. With regards to the resources we've got deployed within the organisation, we've got quite a few resources deployed in moving into this. Once we move into the actual transition sort of planning, there'll be specific resources, particularly around the new service models being developed, they'll be allocated to this. And I guess really the question with regards to will there be additional funding made available to service to the sector, that will really come through once we've had the conversations about what the transition plan looks like, and therefore what's it going to cost the sector to respond to the contracting approaches we're developing.
And I would probably add as well for the state commissioning strategy as part of the implementation plan, that's one of the things central government will have to consider about if we're moving to this commissioning approach across the state, how do we resource that and how do we implement it?
There's been no reference to the state outcomes framework today. How will the department ensure that outcomes-based contracting reflects the wider state outcomes framework rollout? Oh, well, apologies, that was my error then. I should have mentioned that yeah, absolutely. When I mentioned working with the Department of Finance, they do have the outcomes-based management framework, and we'll be working with them about how we implement services. Again, all that is very much a work in progress. Department of Finance were clear that the commissioning action plans were to be developed in consultation with the community sector. Is there opportunity to review and provide feedback to the launched plan? Yes, absolutely, and it will be on the website, and there will be a section on the website where you'll be able to put your comments, and there's also an email, commissioning email, that you can provide updates or comments on. We weren't planning to do a big massive consultation given we've had all the design labs for each of the 4 priority areas, and the plan this year really has a focus on the priority areas, but that's something we'll look at next year as we roll out the next year's plan and we work on that. So yes, definitely provide feedback this year, but we'll probably have more of a consultation next year. What kind of funding will be available to support change and innovation and reforms?
So I think that will be a matter for government, and we'll obviously be reflecting any comments we get from the sector to be put into the business case that we put forward for that.
And we're also looking at that as our individual transition plans as well, to see what the impact will be.
And again, if people have particular concerns, they should contact the lead in that area, I think. So for example, when we did the face-to-face design lab number 2 for the family and domestic violence service providers, communities funded the travel in for that design lab so everybody could meet face-to-face. So the question could be how long is a piece of string, but there are some good examples of some very practical supports to go through this process, and then there's a longer term process. Yeah, that's subject to the budget.
We've always been promised less red tape and ended up with more with no extra resources. How will this be different?
And I think that's one of the things about trying to streamline processes and services. How do we do that? So we're trying to do that in a kind of practical way, as I say, to move to head agreements or master agreements, so there would be less contracts or less bureaucracy. How do you move to more relationship-based management and not people filling out lots and lots of reports? So how do we do that? So there's an absolute commitment to do that, because as I say, I think before there has been quite transactional. So we will be absolutely committed to moving to it. So there's a few things that hopefully you'll see fairly soon. For example, people not doing so many service reviews, moving to those head agreements, putting in the innovation clause and working with you to try and improve services. So we'll be doing that. You will see that difference early next year.
Where is the department in progressing the recommendations from the Royal Commission and the requirement for child-safe organisations? Will there be extra resourcing to ensure all organisations are able to prioritise this work? I'm not sure, Nicole, you want to start off?
Start that answer. So we, the government will be releasing the 2021 annual progress report on implementation of the Royal Commission early in 2022. So there'll be a broad document available publicly that explains where we're at against all of the priority areas of the Royal Commission. So just, I guess, flagging that will be available early next year. With regards to child-safe organisations, more specifically, we're progressing work across 3 streams, I suppose. The first being with Supporting Communities Forum and a dedicated working group that is across government, community sector and private sector, so including like sporting and cultural industries. And the program of work in that space will really be about how do we support implementation across all sorts of different sectors, and we'll be looking at exemplars and models for implementation. So there'll be an emerging piece of work in that space that will be shared widely. We're also looking at implementation across government and supporting coordination in that space. And then there's a number of direct recommendations that we'll be addressing and leading implementation of. So 2022 will be a really active space in the child-safe organisations. It's also a live discussion across all of the 4 priority areas as to how that's built into contracts, and therefore what are the supports that might need to be available for services to deliver that in contracts. So it's a very, I guess, live issue, and it's something that we'll be having a focus on in 2022.
Thanks, Nikki and Tam, for moderating the questions. We've got a few minutes left, and I just wondered if I'd throw to any of the panel members, Mike, if there's any final comments you'd like to make, perhaps.
Thank you very much, Karen. Look, my only final comment is to thank you all most sincerely for being engaged with us through this process thus far. I really value the transparency and honesty of the questions and the discussion that's occurred. I know the design labs have been a pretty intense process, and I'm really grateful for people's participation. We are talking about a change process here, and change can sometimes be quite confronting and difficult, but I certainly, in the 6 months that I've been here, people universally recognise that there's a better way of doing business into the future, and we're very confident that commissioning will get us there, despite the fact that there may be some changes for individual service providers along the way. So we're not stepping back from that, and we're certainly not stepping back from the process. We're very keen to keep this process going. We have to stagger it in the best interest of our capacity to be able to manage the many contracts that we have, and of the sector's capacity to be able to manage the changes that we're talking about as well. So thank you so much for your patience and engagement. Keep those questions coming. We do want to be an organisation that prides ourselves on being available, being open and transparent with our stakeholders and those that we serve. I think there's a dedicated email address which is
There is,
commissioning.
and we'll publish that again.
Which is commissioning@communities.wa.gov.au. So if you've got general questions about the commissioning process, that's the place to go. Of course, you've also got the contact leads of the 4 stream areas, so you're welcome to contact them directly as well with any particular questions that you have. Stay with us for the journey. Thank you very much for participating today.
Thanks, Mike. Did any other panel members have any final comments, anything that you think wasn't covered that's important to cover? No? Good. Okay, so it's my wonderful job to wish you all a happy and safe Christmas and holiday season. Please, if we haven't answered your question today, feel free to contact anybody directly or continue to send through the emails. We will get to the rest of those questions. We thank you again for joining us and take care, everybody. Thank you.